Um, Let me go, Eric, quickly, key trend slide, and we'll do this real quick. Can't tell whether this is a movement. It certainly is a movement in the right direction. We don't know whether it's a trend or not. The last few days, we've seen fewer cases, about 5,000 here. So we're happy that's down, deaths down. We're seeing hospitalizations down a little bit in the same way with ICU. So again, you know, this is 3 or 4 days. I think we've seen kind of a trend downward, and we hope that that's a trend, but we really don't know about that. I'm going to get back to Dr. Vanderhoff for something. In fact, let's do that right now. Dr. Vanderhoff, I want to ask you, we've heard a lot about the discussion about this variant, this virus variant, and really kind of wanted to understand it. We hear about it coming from the UK. We heard about Ohio State discovering something that's here. So tell us what's going on.
Sure, thank you, Governor. Well, we're hearing quite a bit about the arrival of more contagious strains of the virus. I am here to affirm that they're here, and therefore we really do need to understand them. At a high level, what we're seeing is that SARS-CoV-2, the virus that causes COVID-19, is changing through a natural process of mutation to become more contagious. And it's happening not just in far-flung corners of the globe, but right here in Ohio. Now, this isn't unexpected. In fact, it's fairly typical viral behavior. What is particularly interesting, however, is that the changes we're seeing internationally and here in Ohio look an awful lot alike. We've all seen the stories about the so-called UK variant. Its most important mutation is a change in the spike protein that appears to make the virus more contagious. Remember, the spike protein is the business end of the virus. It's the tool the virus uses to infect our cells. Recently, the Ohio State University announced it found the same mutation in a sample taken here in Ohio, but, and this is important, the genetic signature of the virus with the mutation was typical for the US, not for the UK. That suggests the mutation arose here and wasn't imported. Ohio State also reported that for a few weeks, most of the virus currently circulating in central Ohio has been yet another strain, a strain the CDC has seen across the Midwest. And this strain has yet another set of mutations to the spike protein, which are also believed to make the virus more contagious. So it's clear, the virus is changing to become more contagious. And experience suggests these more contagious strains will become dominant quickly, maybe just in several weeks, potentially leading to more people getting sick, more people getting hospitalized, and ultimately more people dying. So what can we do? Well, our first line of defense remains our safety measures, wearing masks, staying apart, avoiding crowds, ventilating indoor spaces, frequent hand washing. And we can expect those measures to continue to work against these variants because despite their mutations, they still can't get from me to you without droplet or micro droplet spread. The mechanics of transmission are the same. And of course, we now have vaccination. And the good news is that we remain confident our vaccines will cover even these new strains, both because of vaccine design, which isn't limited by focused spike protein changes. Think of a vaccine making a piece of Velcro that doesn't need to adhere to every spot on the spike protein. And because of recent research out of the University of Texas confirming that the vaccines are working against the new UK mutation. The bottom line is that the virus is doing what many viruses do over time. It's becoming more contagious. And that underlines for us in bold the importance of our safety measures and when it's our turn, getting vaccinated. Governor?
Doctor, thank you. Thank you very much. Well, timing on this, it's already here. This variation is here. It's already done the variation. When do we have any idea when this becomes the more dominant in Ohio?
Well, it was very clear that the virus, when it was detected in the UK, in a matter of about 2 months, went from being a new entrant to being the dominant strain in the UK. So I would have no reason to expect any different timeline here.
So more reason for us to stay focused on what we do, and more reason for us to do absolutely everything we can to get the vaccine in people's arms as quick as we can, and people to take the vaccine. So thank you very much.